and thank you for joining me. My name is Raquel Webb. I'm Manager of Spiritual Care for the St. Joseph Market, and I'm joined by Tyler Whipkey. Tyler, tell us about yourself.
Good morning, afternoon, evening, whatever time of day it is when you're watching this, everyone. My name is Tyler Whipkey. I'm the Director of Mission and Spiritual Care at St. Luke's Health in the Woodlands, Texas.
Well, thank you for being here today, and welcome to all of you to the second episode of Conversations for the Common Good. So this is a series where we want to respond to this COVID crisis, this heightened emotional, physical, spiritual struggles that we're having. We know that caregiving is an emotional experience, and today's topic is moral injury. Tyler, when I hear moral injury, I often think of military veterans, the struggles that they sometimes face in the aftermath of, let's say, combat. What do we mean when we talk about moral injury, and how can it relate to someone who works in healthcare?
So that's a really fantastic question. So you're right. Usually whenever we talk about moral injury, we're often talking about it in military settings. So one thing that I actually cover both sides of the fence there, because I'm actually a chaplain in the United States Navy Reserve as well. And so moral injury is, it's a fairly new term that people have really only started unpacking over the last decade or so. And it started in the military context. However, as we are moving into this, we're starting to realize that moral injury can occur in healthcare context and healthcare settings as well. And people, when they talk about moral injury, they talk about moral injury and they also talk about trauma. And these two things are often studied and discussed together because they're so closely related. So for the sake of our conversation today, I just want to offer some really broad, and I can't stress enough how broad these are. These are broad definitions of trauma and moral injury. So trauma is a way of naming harm that is overwhelming in its impact, and it disrupts, and perhaps it even ruptures our response, our normal response systems. Moral injury is something that goes beyond. It's extra. It's some feeling of shame or guilt or betrayal or hurt that seems to go a little bit further and beyond of how trauma is described. It is residual and it stays with you.
Okay, wow. So, well, Tyler, I first of all want to thank you for your service to our country and to all of you who may be listening who are veterans and are working in healthcare or still in service to our country. We thank you. But if someone is listening in to our conversation today and wanted to know what are the signs of trauma and moral injury, what would you tell them?
So the first thing that I would say is it really pays to be in tune with your own emotional state, as well as your body, because the body holds trauma. Traumatic events, they overwhelm our normal systems of care that give us a sense of control or meaning and connection. And it's important to understand that responses to trauma, these are normal responses to unusual situations. It's a normal response to what's happening to me. There are a lot of folks that they judge a trauma response in a negative way. They'll say, I shouldn't be feeling this way. You know, I've been working in healthcare for all these years. I've been an ER nurse. I've been an ICU nurse, whatever the case may be. I shouldn't be reacting like this. This shouldn't be getting to me. I can assure you that your reactions are perfectly normal. And, but it's sometimes we react to those in negative ways. Moral injury, it arises in a variety of cases and instances. It can come about whenever you feel complicit in a situation or an environment that you feel is wrong. When you feel that you haven't done enough, when a situation requires more of you, even though you've given your absolute best. Or maybe when you simply just witness something that stays with you or haunts you. And like I said, this is something that it lives in our bodies, and it doesn't tend to go away on its own. It takes intentional attention in order for us to address it. And a helpful way to think of moral injury, again, it's something extra. It can be something that's hard to define and something that's hard to name. Some feeling of shame or guilt or betrayal or hurt that goes beyond how post-traumatic stress disorders are described. And I'm going to take a moment. I'm going to share my screen. I've got a graph. That's not a graph. That's a chart. There we go. A chart that's helpful. And this chart, it's a Venn diagram that talks about PTSD, moral injury, and both, and the signs and symptoms of how they come together. Now, PTSD, you might be wondering why I'm talking about that, why I'm bringing it up. Again, when we think of PTSD, most people jump to a military context. However, there are plenty of healthcare workers and healthcare providers who have been diagnosed with PTSD. So these are some things that to look for, to think about, and how they can overlap and interact together. So beyond just feeling sad, you may begin to doubt your ability to be a good person, or you may doubt the ability of those around you or of your institution to be a good person, good people, or a good place. And it's also important to note that moral injury, it impacts us as individuals, but we also can hold it collectively. So we can hold it as a healthcare institution, and we can also hold it as a society. There's a lot going on in our world. There's a lot going on in the United States that has the potential to be morally injurious. And so we have to come to terms with that fact that this is something that not only impacts the individual, but can impact us as society as well. And there are other situations and circumstances that can precipitate moral distress or a moral injury. And so some things to look for, some things to be aware of. Sometimes we don't have the resources that we need and the ability to care. And the resources, they're just not there despite everybody's best efforts. Think about when COVID started and we were all worried about, do we have enough PPE? Do we have enough ventilators? Do we need to start rationing care? Those were some of the conversations that we were having. And thank God we never got to that point, but that was a concern. Sometimes there are no good choices and we have dirty hands. And that means we have to do what's necessary even though it feels wrong. Sometimes we feel powerless. Sometimes there is unintended harm because nobody comes to work thinking I'm going to harm a patient today. But sometimes, even to the best of us, things slip by and there's unintended harm that occurs. We feel overwhelmed. Goodness, I have felt so overwhelmed lately. Distance. In this COVID world, we know that sometimes patients are dying alone, and that also is difficult and potentially injurious to our conscience. Public protests, that's when we give the best advice to the greater good for the population, but they don't take our advice and they complicate and make a situation worse. And then negligence is something that can also come around. Poor planning by administrators, team leaders, public officials. Again, it's never intentional, but sometimes it happens. Survivor's guilt, surviving and doing well when your colleagues and friends aren't, which is a common source of guilt or shame. And then privilege. And one example of privilege in our setting right now is there are some people who are able to work from home. I say able to, and what I probably should say is mandated to work from home when our colleagues are in the heart of a pandemic. And so those are a few things just to keep in mind, that if you see those coming down the track, you might want to start thinking about how you are responding to those.
Right. So now that we know more about trauma and moral injury, Tyler, can you tell us what do we do about it?
So the thing about trauma and moral injury, again, I've already mentioned a couple of times that this is something that we literally carry around with us. We hold it in our bodies. I mean, there is certainly a mental and emotional aspect and component to it, but this manifests itself physically a lot of times. And so the thing we have to understand is calming ourselves down, it may be a challenge for us. I know that I've come home after a few difficult shifts where there's been, multiple patient deaths, and I've felt the collective anxiety among the staff. And I get home and I found that I can't relax because my brain is still on red alert, and I have difficulty calming myself down. And so I have to intentionally take steps to calm myself down. I have to understand that my sleeping and eating patterns might have changed. There was a while there where I was having a lot of trouble sleeping. I think 2 or 3 nights in a row, I knocked everything off my nightstand by the bed, and then I couldn't go to sleep, and it was really difficult. So be mindful of that. Try to set an intentional bedtime. Set an alarm on your phone for when it's time to go to bed. Drink lots and lots and lots and lots of water. Stay very, very hydrated. Try to avoid consuming excessive amounts of caffeine or alcohol. Those are not going to help you process and get through. You want to make sure that your body has everything that it needs to flush itself out and stay healthy and whole. This next one, give a hug to somebody. Hopefully somebody in your household or somebody that's given you consent to give them a hug. Don't just go hugging random strangers in the age of COVID. That's a no-no. But hug your partner or hug your pet, or if you don't have anybody around to do that, even just giving yourself a hug, because that sense of closeness, it can really help you to release a little bit about that. Take short walks. I have a habit every day here at the Woodlands. We have it's a little trail that goes around Lake Wimberley. We call it a lake. It's really a pond, but we call it a lake so we can feel better about ourselves. But every day I intentionally get out and I walk around the lake because I have to do that for self-care. I have to get out, I have to get my body moving, and that helps me keep from feeling stuck, especially stuck inside the building all day. And then pay attention to your sacred texts. Whatever sacred text you have, no matter what your faith tradition, there is probably a story or a reading in there about someone who has gone through a similar situation. And also some of these scriptures, they're very narrative. For example, the 23rd Psalm, which many people know, it is filled with rich sensory imagery. So if you can't get out of the building, if you can't get away, just take your Bible, take your phone, look up Psalm 23, because it's filled with very rich imagery. It talks about walking through a valley and then coming back up out of that. And so it's the next best thing to getting out. And then the last thing that I want to make sure that everybody's aware of is that there is absolutely no shame in asking for professional help. Our EAP, Employee Assistance Program, it is absolutely free to us as employees, as well as our spouses and our family members, if we need to talk to somebody. I don't mind telling you all that I utilized our EAP program a couple of months ago when this was still in that first climb, and I was overwhelmed, and it was very helpful. And it was all done on the computer and on my phone. I didn't have to go to an office. It was all done at my convenience, and it was absolutely 100% free of charge. Also, a reminder that your chaplains are around and eager and are willing to help you, to engage with you in conversation, to listen to you if you need somebody to talk to. And I cannot stress that enough, that it is absolutely, it's taking good care of yourself if you need to seek professional help. And, Raquel, it can also be helpful to reflect on a moment when you knew what the right thing to do was, but you were unable to do it. And it can be helpful to just give voice to that and to say it out loud, because I don't know about you, but I am the king of having conversations in my head with those coulda, shoulda, woulda dones, but I rarely give voice to them. But when I do, I found that there's a healing element to it. And so I just want to invite you to think about, in a moment like that where you knew what the right thing to do was, but you couldn't do it. Who or what prevented you from doing it? And what was the outcome? And as you reflect or share, I want you to notice how your body is feeling physically. You may feel sensations in your throat or your chest. They may feel kind of heavy. And that's where we typically hold these emotions whenever we feel stuck, because that's part of moral injury is we've come to a point where we feel stuck or we've felt helpless and unable to impact the outcome in a way that we think is right or good or ethical. And Raquel, I'm going to invite you, if you're comfortable with it, to maybe share a moment that you had.
You know, I can think of several examples off the top of my head, and I can tell you automatically my heart is beating faster. I'm alone in my office, but I'm having that reaction. I don't know if you can hear my voice is a little shaky. I think what I feel okay sharing with you is maybe an experience that a lot of parents out there have recently had, where we've had to choose what to do with our kid when school goes back. Do we send them to school, or do we make a choice to have them learn virtually? I see a lot of also what you shared about the precipitating circumstances, especially with feeling overwhelmed over this decision, feeling that I'm being negligent either way with whatever choice I make. And in the end, Tyler, the thing that I believed to be the right thing to do was not the option that I was allowed to make. And you asked me what stopped you from going where you wanted to go. And in this event, it was the circumstances. It was COVID, it was the job, the responsibility, the needs of the children. A million things stopped me. And the outcome is that I really do feel daily the weight of the decision I made. And so I'm experiencing some of the symptoms you mentioned just now. I can think of another example also in my work in patient care. Sometimes it's difficult to not be able to help more. I want to do for my patients what I used to be able to do before COVID. But again, circumstances dictate that I can't or I should not. They stop me. That goes against everything within me as a chaplain and as a caregiver. And I think I recognize that as well as a moral injury. And with that, again, I want to point you to the links on this video that have some resources that Tyler has attached. Remember your chaplains. Chaplains are great listeners. They can help you process your moral injury and can give you tips. And then the EAP, I want to reiterate what Tyler said. And you really have available to you 5 free sessions per problem. So you or your child or your spouse could have a problem, let's say my problem with school. That's 5 free sessions. And then if I have another issue in 3 months related to something else, I can access the EAP again. It's a great resources. I want to thank you, Tyler, for your expertise. And I want to thank each of you for taking the time to watch. We really are enjoying this series, and we look forward to being with you again at our next episode. Be well.
Have a great day, everyone.